Hello everyone. So I welcome you back to another exciting discussion. Today I'll be talking about a very common symptom of neck pain. Now I'm sure that you must have heard about a condition called cervical spondylosis. Cervical spondylosis per se is not a disease in itself. It's a symptomatology that the patients experience, and one of the most common symptoms in cervical spondylosis is neck pain. Coming to what causes the cervical spondylosis. So, in order to understand more about cervical spondylosis, I want you to understand the structure of the spine at the level of the neck, also called the cervical spine. So, in the cervical spine, we have the main nerve, which is the spinal cord. And in order to protect the spinal cord, we have bones, which are the vertebrae that are stacked over each other. And in between the vertebra, we have the shock absorbers, which are the disc. Together, the spinal cord, which is protected by the vertebra from the front and behind, as well as the disc, they render it stability as well as mobility. So, it makes our cervical spine stable as well as movement is possible. However, just as the shock absorbers, they start getting worn out due to repeated movements, we see that as the age progresses, the disc, they degenerate. That is, they lose their flexibility or iteration. So that is what usually starts cervical spondylosis. However, apart from the disc, there is also some degeneration or arthritis that happens in small joints, which are called as the facet joints. And as a reactionary mechanism, the body also forms some small bones, which are the osteophytes. And together, all these things lead to the patient's complaint of neck pain. So how do the patients of cervical spondylosis present? So when they come to our clinic, the most common symptom for those patients is neck pain. Apart from that, the patients also develop some stiffness or heaviness around the neck area, especially when they are working for a long time. Patients also say that if there is some activity resulting into heaviness, as soon as they rest, they feel a little better. If the nerves or the spinal cord is getting involved, then the patients also present to us with upper limb tingling or numbness or weakness. In alarming cases, the patients also present to us with difficulty in walking or objects falling from their hands. So whenever a patient is present to us, as usual, we like to go through a detailed history. So we ask a couple of questions regarding the pain character in order to understand how bad or severe the pain is for the patient. We then do our neurological exam. We try to see if all the nerves are functioning fine as well. And then based on these things, we like to investigate the patients. The first choice investigation always is an X-ray. It helps us to know what is the alignment of the spine and also tells us about overall bony changes and if there is any degenerative changes or age-related changes that the patient has. Then, if required, we also like to go for MRI scan. The MRI tells us about the soft tissue structures as well as the gravity of the problem and if there is any spinal cord or nerve root compression. Point to note is a majority of my patients currently are experiencing neck pain much earlier in their life. So what used to be a problem that we used to see after 50 or 60 years of age, now we have started to see it even in 20s or 30s. A major cause for neck pain in this age group, apart from the degeneration, is also ergonomics. So all these patients that present to us, they spend considerable time in front of the PC, iPhone, iPads or any other gadgets. And usually the form or the posture is pretty bad. Also, a lot of kids are now complaining of neck pain, and a usual reason is their neck, which is usually in a downward position or in front of the PC, and which is for hours together, and that is also a major cause of neck pain. Now coming to the treatment, as we already discussed, since it is more of posture ergonomic related in majority of the cases, some amount of medications, physical therapy, as well as posture correction and ergonomics, they go a long way in correcting major causes of cervical pain or neck pain. In minority of the patients, if the nerve is getting impinged, then we like to do intervention. The intervention is usually in the form of surgery, and that the type of surgery, whether it is minimally invasive or open, depends upon what is the underlying pathology. But as we know, prevention is better than cure, and for majority of the patients, simple ergonomic changes, doing stretches, regular exercises, and reducing the amount of screen time goes a long way in either prevention of cervical spondylosis or arresting further progression of cervical spondylosis. In order to know more, please feel free to get in touch and we will be happy to help you.